Hello again, and welcome to another episode of the Digital Health and Wearables series. If you have not subscribed, please do so. Share with your communities in healthcare and check all the amazing guests. I have another episode for you today, but before I go ahead, I'd like to acknowledge our global partners, Spirit Digital, and also our series sponsor, Ascom. They are specialists in healthcare wearables and digital monitoring. But without further ado, it gives me great pleasure to introduce Dr. Noel O'Kelly, which is the clinical director of Spirit Digital. Noel, how are you?
Oh, I'm great. How are you? Thank you very much, Joe, for inviting me here today. Looking forward to our conversation.
No, brilliant. Thanks so much for taking the time out of your busy diary to be here.
Not at all. A pleasure.
Great. So let's get on with the questions. I mean, you've been doing great work in the space, and the first question, Noel, that I have for you is how has adoption of clinical pathways changed since the start of the pandemic?
Yeah, it's a really good question, actually. I don't think it's understated to say that the impact and I suppose the silver lining of the cloud from the pandemic has been the digital health revolution. I think it has, we've seen much more uptake of digital solutions within pathways. And I think that's obvious as to the reason why that is, because patients and clinicians wanted to feel safe, but still wanted to have effective means where they could connect to each other. I think across the UK and internationally, we've seen an increase in the use of triage for patients to decide what is the correct pathway and the correct way that we connect to patients. We've had an uptake in telephone consultation, video consultations have gone off the roof, but also we have had an increase in question sets and clinical algorithms to track patients within their long-term conditions. So let's be honest, this whole COVID situation is going to be around for us for many years. So I think we do have an opportunity as people who are very passionate about using technology in healthcare to really completely change the landscape in the way that we deliver healthcare services. And there is no doubt is that when we reset, I'm sure we will reset to having more face-to-face consultations, which is entirely appropriate. But I think we're going to reset. Our minds have been stretched. And I think we are going to be looking at using more and more technology within the ways that we manage and care for our patients. And I think also that clinicians are getting more used to the idea, and also patients are becoming more and more acceptable to the use of technology in the way that their conditions are managed.
Oh, brilliant. Great point there that the patients are, of course, more aware of keeping track of their own conditions. But brilliant point about the pandemic also set a new benchmark. And I've been talking, as you know, to many people. It's probably one of the positive upsides of the pandemic is pushing these agendas forward, forcing us to work in a different way. So thank you so much for that brilliant insight. The second question that I have for you, Noel, is what have been the challenges in getting digital adopted within the clinical pathways, and how have you overcome them?
Okay, so I think with anything new and anything that is asking people to work in a different way, there's always going to be a little bit of stickiness to people adopting new ways of doing things. And interestingly, the people who have adopted the new ways in the areas that we've worked with, those who already started to use digital technology in their pathways. So I think some of it is a little bit of skepticism about how what the digital health solutions could do for clinicians and patients. So, sometimes clinicians have been almost the gatekeepers to patients getting this kind of technology because they feel, well, it's not for them, or they won't be able to use it, or they won't have the skills and competencies. And what we're actually finding is that of those patients who have experience of using our digital solutions and our platforms, that the patient satisfaction and acceptability is off the wall. And maybe that's because at least they're feeling safe with COVID being around, but they're still feeling connected. And in fact, in ways, they're more connected now than they were previously. Because when you look at a GP or a hospital consultant, they maybe see a patient for 10 minutes every 6 months or every year. With the use of remote patient monitoring, with the use of wearable technology, we're getting data, real world data, that actually tells us much more and gives us a much more robust and much more rich data, clinical data for patients that helps us as clinicians to make decisions as well. I think some of the other issues is how to embed within pathways and the complexity that clinical pathways have. So the way you might deploy a clinical solution might differ in one health economy to the other because there are different skills or there are different services. So actually looking at and working with clinicians across a pathway is really important so they can see the benefit and it makes sense to them. The other thing I think which has been challenging is the commissioning and the funding and the strategy of the deployment of digital solutions. And it's quite understandable because commissioners had to work, or payers had to work really quick to get these solutions out there. And it has been a little bit ad hoc at times. And now is the time that we have a much more cohesive strategy of how we're going to deploy these solutions within clinical services. So I think at the moment, a lot of the funding has been interim. We need to be looking at how we're going to be funding these new ways of working as we move forward into the future.
Oh, brilliant. Thank you. It's actually fantastic that you mentioned wearables, also, of course, the new technologies, the new ways of working, and you mentioned the funding is always an issue. Where is the money coming from? But I think, I mean, the ones holding the budgets are more aware that they need to have, as you mentioned, a strategy going forward, allocate the money for this to happen. Otherwise, the digital transformation in its own right will never happen. And now is crucial that the funding is in place and everyone is on the same level. Digital transformation is complex, but it must be done. So thank you so much for that brilliant insight. And the last question that I have for you is, what can we all expect in the future?
Well, I think we're not going back to the way things were before. I think our minds have been stretched, and I think we're looking at new ways of delivering the services. What also has been, I think, very good is the fact that because of the needs and because of COVID, health tech companies have had to really move forward in their development and have had to flex to what the market was. So I think there have been massive changes in what's available out there. I think there are going to be some challenges around how we make sure that we have all these apps and we have all these wearables and we have all these other things. How are they all going to work together? And I think that's part of what I said is around having a cohesive strategy. And we're already working in a number of areas where we're looking at with other providers that we're working through a common care portal so that information goes into the EMR, information between different apps can work together. And I think that's a challenge to us within this industry that we need to deliver on. I think also the point I made around real world data, we're getting more and more data. Sorry about that. We're getting more and more data now, which means that gives us an opportunity to plan better in the future. We have, I think, quite exciting is as well as the way we can passively monitor patients. We'll see more wearable devices, so patients, rather than have to enter the data themselves, they'll be happening in the background. We're already seeing that with some of the smart watches that we have, etc. All that information coming together will help us then to start predict when patients are deteriorating and help us to plan for the future. So I think we're really in an exciting part of the industry. I think we have a window of opportunity to really drive forward this in the next couple of years, and I'm really confident that we will do.
Brilliant. Noel, you mentioned so many things there. I mean, I'm a passionate around wearables, and I'm an
Yeah,
advocate. I follow all these trends and all these things. You mentioned some really important points there. Of course, the fragmentation of the systems, integration, data. Also, there is no clear benchmark around, for example, data benchmark for the quality of the data. The other day, I had a very interesting conversation with another leader, and she said that data proliferation is also an issue because we're getting a lot of data from all these places. And you mentioned the health hubs, so it's certainly a very interesting conversation. Much more to be done. We can talk for hours. I know the interview is short, but
yeah,
no, I want to thank you in advance. Before I finish, um, I finish all my episodes in the same way, which is not really a question as such. Is 1 minute of fame. Over to you. You can talk about anything, a personal achievement, a professional achievement, can talk about Spirit Digital, can talk about any colleagues, your family. I mean, no, anything whatsoever. So 1 minute of fame, over to you.
well, I've worked as a clinician for the last 35 years, and I'm now working in with Spirit, and they're a great company to work with. We really look at the technology and help how to embed it and how to work with other clinicians. And it's when you start to see the benefits that are happening to patients and clinicians, it really means it means an awful lot to me. I'm very passionate about how we use new technology because with people getting older, with more complexity of illness and disease, with the workforce that we have, we have to find new ways that we can reflect on what is needed within our patient groups. And I think I'm really excited to be in this industry now, having kind of flirted with it for a number of years. So yeah, I'm looking really forward to the future.
No, what a great way to finish. Thank you so much. Before I round up, I want to personally thank you so much for your expertise, your time, your input. That's been great.
You're welcome. It's great to talk to you again. We'll talk soon again, Joe. Take
Brilliant.
care.
I'm gonna round up. So thank you so much, Noel, and to all our viewers. If you have not subscribed, please do so. And I'll see you again next week. Make sure you check the links with the Spirit Digital on the body of the text in your interview. Also, ask them the specialists in healthcare wearables digital monitoring. So I'll see you next week.
Thank you. Take care.
Take care.